You're getting a lot of comments from people, it sounds like, that are experiencing things that they can't say in public, but they want to talk to you about them.
There is a lot of that engagement behind the scenes because people fear the FOFO, the fear of being found out.
Yeah.
And so most people are smart enough to know that if something I write about resonates with them, that their employer may be watching. And so they come behind the scenes and tell the story.
Yeah.
And say, oh my God, I read that. That could be me. And they're often, a nurse leader or a physician, and they're very touched by it. But then, so because of that, what ended up happening, because I've been writing on LinkedIn for about 3 years, was other people saying, would you share my story? And so they know that I go to great lengths to protect identities to the extent that I rarely will ever refer to a gender. I definitely don't mention the name of the hospital, the region, any of that. And sometimes I don't even mention the specialty. So if it's a physician who shares their story, because that's all irrelevant. It's the story of the message of what this person is going through or a decision that they made and why. And a lot of them do that because they like the comments and they feel validated.
Been religious with how often and how close you pay attention to your LinkedIn, not only the postings that you do about events that are impacting you, like you put your heart out there, you talk about your day, sometimes you talk about things that have happened in your world.
My dogs that
Your
have all since
dogs.
passed.
Yeah, exactly. I mean, and you show your heart and whatever the topic is, right? But it's what is in your world at that moment that you're going to talk about or write about. And you have thousands and thousands of followers. You have people who engage your content on LinkedIn and in ways that I absolutely admire. I mean, because truthfully, it's hard to build that. I know what it takes to build that. And you are, as you should be, protective of your audience. You're protective of the message that you put out. You want to be considerate of what you're putting out. But then the people who interact with you, that means something to you, and you respond. And then in the background, you're getting a lot of comments from people, it sounds like, that are experiencing things that they can't say in public, but they want to talk to you about them.
There is a lot of that engagement behind the scenes because people fear the FOFO, the fear of being found out. And so most people are smart enough to know that if something I write about resonates with them, that their employer may be watching. And so they come behind the scenes and tell the story. And say, oh my God, I read that. That could be me. And they're often, a nurse leader or a physician, and they're very touched by it. But then, so because of that, what ended up happening, because I've been writing on LinkedIn for about 3 years, was other people saying, would you share my story? And so they know that I go to great lengths to protect identities to the extent that I rarely will ever refer to a gender. I definitely don't mention the name of the hospital, the region, any of that. And sometimes I don't even mention the specialty. So if it's a physician who shares their story, because that's all irrelevant. It's the story of the message of what this person is going through or a decision that they made and why. And a lot of them do that because they like the comments and they feel validated. At times, I've had people venturing down a litigious pathway, and the comments actually helped their case.
Oh, interesting.
In some cases. And then there are people who will read a story, and I do offer them, and again, I don't charge for this, and I give them feedback, and sometimes a lot of what I'm giving them is the playbook for various things. And I'll say, based on my experience, this is likely to happen. This is what you should do. This is what you should watch out for. This is what you should say, not say. And oh my God, those people will come back and go, that's exactly what happened to me. How did you know? And I'm like, well, because I've seen it happen. And so almost to the extent that I paused for a bit and thought I would write, people said, you really should write playbooks on these various things and sell them. And I'm like, no, it just didn't feel right. But for the occasional person who now reaches out there's enough of that content out there that if people really wanted to research it, they could go back and see the various topics and playbooks that I've written. But people are very respectful for the most part when they reach out and they're hurting, and you know they're in pain just by reading their story.
Yep.
And I do take the time to go back and forth with them and make sure they're okay, first and foremost, and, ask them questions, and, they give me details of the story. And then what I love is that, when they give me an update on how they resigned, and this is what they're doing today, and how they're feeling. And some of them have tapped their entrepreneurial spirit, and this is what they're doing. And I stay with that journey.
That's awesome.
And then others, it's really kind of funny because so many of them, like physicians, randomly that I've never had a phone conversation with and I've never met with virtually, but they feel they know me and I know them because of the chatting back and forth. And, occasionally they'll send me something like, a box of gourmet steaks or
nice.
A gift package with various things, or it's sometimes it's just random.
Sure.
And it's just, hey, you've helped me out so much. And I'm like, really? Yes, you listened. And, I know I can trust you when I share my story, and I feel like it's a person I can reach out to. And I don't feel like it's a burden because it's very easy for me to communicate with those types because they're polite and I understand their challenge. The story that they tell really is relatable to me because either I've been through the same thing or I know others that have been.
Yeah.
So it's not, it's really real.
Yeah. You can tell too, when you respond to people based off what you've written, it comes from a place where, they know you've been there in some form or fashion, and that they need to relate with somebody. And again, humans of healthcare to me, going back to that, is a little bit, it's a lot about that. It's about relating with other humans that are having experiences, and for you to write in a way that prompts folks to reach out and feel comfortable to trust you, a perfect stranger, based off of the way you've written,
Well, and
really
it's
impressive.
That brings up a thought, is that because what I write about and talk about all the time, because it's always been my management style. When I first started out in healthcare and I didn't know a whole heck of a lot, in clinical areas, and I was always curious and had a fascination with the clinical side of things in medicine, but I didn't know because I wasn't trained clinically, so I always would go, had access to the ICU, had access to the ORs, had access to the emergency room, all those places, and I could walk into any of those places at any time. But even to this day, it doesn't matter what my role is, I always view that that's other places' workspace, so I still would do it with permission.
Oh, sure.
Do you know what I mean? Like I would never be the person that would just barge in and expect that people have to drop what they're doing and, oh, she's here, what is she? No. It was always, and also being respectful of patients. Because, you're not in clinical clothing and you're walking in, so you don't want people to think there must be a problem here because she looks kind of official. So it's never that person either. Never. But the point is that it's amazing how people that are strangers reach out to me. That I've written about several times, the fact that I will often, put out the message, call to action to, if you're a hospital leader, you need to get out, and I'll often say, take a walk on the wild side. And I mean that. And what that means is, and I'll go so far as to say, put yellow crime scene tape around the C-suite, do whatever it is, but to send a visual cue that says, we're closed for business, and unless it's a critical meeting, no meetings, and let your executives, at the C-suite level, chiefs of this, chiefs of that, senior VPs, executive VPs and VPs, go out and spend time with their people. Engage with them and whatnot. And as you know, some of them are going to be like horrified, like, hey, I didn't sign up for that. I really like to go to meetings all day because I am not a people person. I do not want to be in the front lines.
It actually scares them, right?
Right. But it's all over the place. And then there's those that, would be like, how am I going to do my job? Because that's just too much.
Right.
But I've written many times to say, when I've shared stories, I've said, these are virtual strangers who've come to me for help, for support, for validation, and they don't even know me And shame on you that they can't go to someone in
Good
your
point.
system
Yeah.
and safely have a conversation.
Yeah.
And so I the first time I wrote that, it was with a physician who'd written to me, and she saw that, and she knew I was writing about her because she had just shared an update on her story and periodically would write to me.
Yeah.
And she wrote to me behind the scenes, and she said, "Oh my God, you are so not a stranger. You get it. You know, you're a friend." And now again, I've never had a phone call with her, never had a virtual meeting. It's all been through messaging. But she said, there is so much trust and respect that I have for you. And she said, you are far from a stranger to me.
Wow.
You're a confidant that I know I can come to and share something. And that's what she said.
Wow.
And many of us have said the same thing.
Sure.
But still the point is that, I might recognize them if I was at a conference and bump into them because maybe their picture on LinkedIn is recent.
Yeah.
But for the most part, I wouldn't, right?
Yeah.
Because I've never met them virtually and so forth. So,
well, you've said this too. Just in our last conversation, I picked up on this where people are coming to conferences around Boston or whatever, and they'll ask to come meet you, or if you could come see them wherever they are. I imagine some of these people you've never met before, you've just gotten to know through your writings and putting things out there over the years, and that's pretty impressive to have them really want to touch base with you while they're in your area, right?
Yeah, and it happens a lot.
Yeah.
And I appreciate it. And I wish I had the ability and have time to be able to, for example, so a lot of the work that I do is in the Dallas-Fort Worth area.
Uh-huh.
And so my network there has grown quite a bit because of that work.
Yeah.
And sometimes I'm there for 3 days. Sometimes I'm there for 5.
Yeah.
But it's very hard to be able to, and as my network grows, I might write a story about the work I'm doing in DFW. Well, guess what happens? Then, and I might even say, I'm heading back to Dallas in a couple of weeks, and all the people that I know in that network, in my network, in that region that I'm either working directly with today or I've actually met with many in person because I can see a future where they could be brought into some of these projects. Mm-hmm. And I respect them a lot, and I wanted to get to know them. So when I am in Dallas, a few of them I've said, yes, let's have coffee. Because if there is an opportunity to pull them in with the nature of their background and expertise, and conversely, they've said the same thing, it's worth it. But you can't possibly meet with everybody when you've got thousands of people in your network that live in DFW.
Yeah, totally.
So my dream is to one day be able to have some sort of a gathering in strategic places where my network lives and where I can be. Boston is obviously one of them, but Dallas-Fort Worth, for example. Mm-hmm. It could be here in Florida as well. Yeah. Different regions, and it's not anybody selling anything. Yeah. It's free. It's a social opportunity for people to get together and meet face to face. Yeah. And put that out there, and maybe it's a group of limited to 25 people, whatever it is, and it allows people to just kind of like an open mic type thing where they get up in 5 minutes and say, hey, this is why I'm here, and this is who I am, and this is what I represent, and what do I do, and that's kind of really it. Yeah. But the mission is to bring really good people together. Yeah. I've paused on that for a couple of reasons. One is just managing the time. Because let's just say I did that and I went to a place. How would I be able to have a meaningful conversation with 25 people? Yeah. And if there's 25 and 20 of them I have never met in person, but I feel like I know and they know me. Yeah. I'd be frustrated that I wouldn't be able to have more of a conversation.
Totally, yeah. It's a
and how do you manage that?
Yeah, it's tough. Yeah, I agree with you.
But all of the people that I'm talking about, they're all humans of healthcare.
Yeah.
Because I've gotten to the point now where I've had to put up guardrails and set boundaries for myself. Yeah. And so that's another episode we can talk about. What do I mean by that? There's a human aspect of some of the people, but they're not quite the humans of healthcare that I really want to spend my time with.
Yeah. Gatekeeper. Remember, like that's the thing.
I have to be a gatekeeper for myself.
Do. Yeah, for yourself, and by doing it for yourself, you're doing it for these people that might show up in that room that you're talking about. You can't have any Yahoo showing up in that room. People
reach out to me frequently for references on others. Yeah. Sometimes they reach out for introductions. That's number one reason. Yeah. But they'll also reach out for references, and I'm careful about that.
Sure. You
I'm
are.
careful, very well. I'm careful about not if I don't have full knowledge of somebody in there, I'm not going to not endorse them.
Yeah.
I will be transparent and say that I don't have clients working with them, or I'm not fully aware of what the value proposition is, and so I can't make that recommendation.
Yeah.
But I don't. It's rare that I will endorse people and
Yeah.
companies and whatnot unless I have firsthand knowledge.
Yeah.
And I feel extremely comfortable that the person, I respect them, they respect me, and they're not going to embarrass me, and they're not going to waste the time of the person who reached out and asked for an introduction. I
Yeah.
want to
Yeah.
make sure that it may not lead to a business contract, let's say, that's okay, but at least it's going to lead to a meaningful conversation that both parties can control, and I'm not going to be feeling uncomfortable about it.
Yeah.
It's
Yeah.
very important that I'm not embarrassed, and I don't want others to be embarrassed and waste their time. But there's a lot of people out there in healthcare that could be better humans.
Yep. There's a lot that could be better humans. There are some that we were talking about earlier that I also have, like this book, Let Them by Mel Robbins, that I'm listening to right now. There's so many things in my life where the timing's been so great. And this morning I was listening to a passage, and, you could still be good and a human of healthcare in the right way, but be getting bad advice, or, following the wrong popular trend, or not knowing, just being ignorant, frankly, of stuff that you probably should know if you're going to walk that path, and it doesn't make you bad. And I can tell this, you don't feel any animosity towards those people. You just want to say, hey, look, guys, you might want to watch out for this, or here's this thing over here, consider this, whatever, because I see you're walking down this path, and you present to be a good human of healthcare, but you might have this. And with people like that, I've sought that out. Like I look for mirrors. I call that sort of a reflective thing, where if you can find somebody that can be a good mirror for you, you could actually proactively avoid some things, but you have to, again, boundaries and all the things. As you develop your network, you have to, make sure you have the strong boundaries, and, who you trust is in the right place for the right reasons. And you do a lot of this. You do a lot of the gatekeeping, the vetting, the things like that, just naturally. It's not like you're putting them through a formal run through. You're just naturally just sort of taking what they're showing you.
Right. And so I've become in this space as an independent consultant in healthcare that has experience in operations, finance, health systems, community-based practices, independent practices, but also, revenue cycle, strategic planning, risk management, all these things.
Yeah.
And now a lot of the projects that I work on in partnership with independent physician practices is with third-party administrators, benefit consultants on behalf of health systems that are developing what we would call branded, white-labeled benefit plans that they obviously provide for their workforce, but they also, through these companies that I am partnered with, market it to employers in those regions. The biggest part of my role is supporting the independent physician practices, namely primary care, in those networks.
Yeah.
A lot of the, like Dallas-Fort Worth, one of the fastest growing city population in the country.
Yeah.
And the challenge is not enough primary care physicians. So the primary care physicians that we do have is doing everything that we can to make them viable. And right now they're struggling to survive, and they're not thriving.
Yeah.
And so a lot of the work that I'm doing is around that. But in the meantime, there are people out there that maybe didn't have healthcare background and experience, but then COVID, kind of made it almost sexy to get in and solve that problem, because it was kind of like 9/11 when it was tragic, and people all of a sudden wanted to join the armed forces, or they wanted to get into Homeland Security. That's when Homeland Security was born out of that.
Sure.
And so all good intentions, and a lot of those people were incredibly authentic, and thank God for all of them. But then there's always, I don't want to say they're bad actors, but people that aren't quite authentic and jumped in with solution. Maybe they started writing about it and this, that, and the other, but they've never walked the talk. They don't have the first-hand experience, but they mastered the headlines and the bait to be able to jack people up with the negativity.
Yeah.
Right?
Oh, yeah.
And, the terrible health systems, and look at the, the bloat with the CEOs and this, that, and the other thing.
Yep.
And used all of the journalism that's out there that's available to us with the negative, breakdown of various things that these horrible CEOs and others are doing. But there's a lot of really good things happening in health systems with some really good leaders. But the people that, in my mind, like, again, I'm not saying they're bad actors, but the people that, to me, aren't the humans of healthcare that I would ever want to have a conversation with on this podcast, and I never will, are those that, when I called them out on it, they laughed at me. And, wanted to monetize certain things. And, I called them out to say, well, those of us that could monetize that and actually legitimately do it, we can do it because we've been doing it for 30 plus years.
Yes.
And the people in my network, my personal network and my professional network, that would be able to teach you those things, because I had somebody ask me if I could make introductions to teach them.
Yeah. Yeah.
I said, in a Teams meeting, in a virtual meeting, I mean, that's just like an insult to these people, because they grew up in the ranks. And yes, they have master's degrees and formal education, but they also started, lower. And if it was finance, let's say, they might have started out as an accounting,
clerk or something.
Right. And they worked their way up.
Yeah.
And, they put in their years, and it wasn't easy.
Yeah.
And so to me, there's lack of self-awareness, there's lack of authenticity. And I try to be polite. And so when people reach out to me and ask for help for various things, can you endorse this, support this, buy this, write this, introduce, all these things, I often, sometimes it will be that, thanks for thinking of me, but that's not my area, or thanks, but no thanks, I don't have the time, whatever. But you'll find that, like, LinkedIn is interesting. People that will engage with you for a period of time, and then all of a sudden you start getting messages from them, because it's really leading up to, they're following the rules, I guess, of engagement on LinkedIn, which says, you need to comment on somebody that, that writes, that has high engagement, and then you need to follow them, and you need to engage with them, and then you need to send them a direct message. In my case, because of the topics that I write on, a lot of those people were entrepreneurial physicians or nurses. And I say entrepreneurial because, in addition to the ones that are still clinical, that are writing their stories of, the challenges and the pain points, and they felt like, you're an outlier as an administrator, and it's great that you write the truths that you do. And there's no one out there like you that we can't find. So thank you and we trust that what you're saying is true, because I would call out executives like me in hospitals who love to hide behind doors. They're armchair managers. They wouldn't be caught dead walking the halls of a hospital, and they certainly wouldn't put sneakers and scrubs on with as consistency as I did. And that's how I know what I know. But as soon as you say no to some of those that, you see them engaging all the time, now I can spot it. Because I know that, it's a matter of time, they're going to creep right in. And then when they do and you say no, or you might actually guide them and say, that's great. What your value proposition is, why don't you write about it? And why don't you ask permission of your clients that are satisfied? They will love that. And, you talk about the success story and send that to me, and I'd be happy to promote it.
That's great.
And 99% of the time what I get is, we don't have any clients, or we're coming to you because we're hoping to get an introduction to, a CEO or a CFO or a CNO. And then when you don't do that, you honestly never see those people again.
Vanish.
They not only don't come back, which is fine, but now they just disappear. And so that's where I say, and many of them are clinicians, so I'm going to say that they probably are great nurses, doctors, whatever it is that they do clinically or did. But I question that, because I engage with people all the time, and I don't want anything from them. And if I am going through LinkedIn and scrolling and I see something that resonates, I don't comment to be seen. I never do.
Yeah.
And so I get decent engagement. I could probably
Yeah.
be doing a whole heck of a lot more if I followed those rules that say, comment X amount of times, that do all these things. And I'm just like, oh my God, I don't do that. I comment if what the person is writing resonates with me and I have something to say.
Just genuinely. Yeah.
100%.
Yeah.
That's what I do.
Yeah. It's not a formula. It's just a feeling, right?
I have had people tell me early on before I started writing in LinkedIn, and I just take 30 minutes a day and go through and like a bunch of stuff. I don't even read it. I just do it and I'm thinking, wow. And that stuck with me because that was a person who people within my network professionally that I work with looked at that person as smart and this, that, and the other. And I'm thinking to myself, oh, it's kind of crazy.
Yeah.
So anyway, so that's just not me.
Yeah.
So the humans of healthcare are those people who stay in for the right reasons, and there should be reciprocity. That doesn't mean that strings attached, but reciprocity means don't just be the taker.
Yeah.
And so
I was thinking about that.
I have people reaching out that ask for a lot.
Yeah.
A lot.
Yeah.
And it's probably 80% of the people that reach out, if not 90, all want something and ask for something.
Yeah.
And maybe it's 10 or 20% that reach out just to say thank you for writing and so forth. They're not asking for anything.
Yeah. So reciprocity is a big deal, but I think also like my season I'm in is giving, and it's actually even, I think you get better results when you reach out to give. Like I always offer, if anybody needs a kind word or to be uplifted, like I want to put that out there because it's nothing for me to give a kind word and lift you up, but I want to give. I go into the interactions wanting to give.
And I do that too. I'll post once in a while, and I'm like, I know people might, because I'm not on Meta, Facebook, or whatever we want to call it these days, but occasionally, I always write in the moment.
Yeah.
And I get up early in the morning, and I usually write from the heart and mind.
Yeah.
And if I don't have something to say, I don't write at all. So I'm not one of these people that says, oh, you must post every day.
Yeah.
Well, no, actually you don't, and I don't.
Yeah.
And so that's okay.
Yeah.
And so sometimes it is a simple message that tells people that, you need to take a break and do nothing and that you matter.
Yeah.
And that's all my message is sometimes. And it might be accompanied by a picture. Yeah. And some people might say, well, that's Facebooky or what. I don't really care.
Yeah, it doesn't matter.
I don't really care. But again, the humans of healthcare though is, like I said, a lot of people that are behind the scenes and also people out there in the industry.
Mm-hmm.
They could be health insurance people, benefit consultants.
Yeah.
Those are all humans of healthcare too, because there's a lot of people out there that I work with that really care about managing people's care. They care about population health. They care about patients having access to primary care.
Yeah.
And they care about the cost of care.
Yeah.
And so benefit consultants work to great lengths to work with employers to develop plans that steer their workforce to lower cost alternatives, not lower quality, but lower cost.
Right.
So that patients, when possible, can go to an ambulatory surgical center, freestanding imaging, labs that are cost effective, as opposed to having everybody go to a hospital system where the overhead is higher, so the price is higher.
Yeah.
And so those to me, now again, in that industry, they're not all good humans of healthcare.
Of course.
I'm aligning with those that are good humans of healthcare.
Yeah. That's what when I think about you, I think about that. I think about, gatekeeper is such a great term. We're going to use it a lot, I'm sure, as we talk. But the truth is, like, nobody has time to go through and fail all the way with all of the different options. They can only evaluate so many. And with building a personal brand the way that you have, the way that I've tried to, right? If people watch this, they can get value. And it's so funny how we've kind of come full circle in this story today, and that Gary Vee was in this crowded room and somebody asked him for advice about how to keep my daughter from, potential vultures that are in social media. And his advice was, and by the way, Gary Vee can be vulgar himself. He can spew a lot of really, like dirty words. A lot of people don't like his style. But what came out of his mouth was really, really interesting. And so he said, internal confidence, the ability to know thyself, and all these things that he was saying back to this lady to give her comfort about her daughter, having the strength to make it through what was being thrown at her. It's funny that, we're talking about, that's what you're just describing, is there's a lot of people throwing a lot of things, in healthcare. And when they throw them at you, you filter, and you have a filter that will keep out the people who are, not the humans of healthcare that we want, that we might not invite onto a podcast like this. But it also opens the door for those that trust you to kind of see who you would work with. And I think it just helps them with the time to narrow down their choices. And I think about it with AI right now. I think about all these things that are being thrown at the healthcare workers, the providers, and they don't have time to filter through this stuff. So you almost, I had a CEO tell me this the other day, a good friend of mine who's out in rural America, and very rural America, and he struggles with his hospital. And he said to me, Danny, I have to latch on to people that I trust. I have no choice. He said, when I get into a situation where I'm making a choice about a product that I don't know, because I don't know the person or the people that are trying to sell to me, that's when I get out of my depth and I get really nervous about making a risky decision. But when I know somebody, I go in with confidence. I can make a much better decision. There's a lot of value in what you're describing here, and building trust in your brand with people. That's a hard thing to do. And
so that's what I was touching on earlier, is that so I become, people use the term connector.
Yeah.
And I never viewed myself that way, but I am pretty good at vetting people and vetting solutions. And like I said, doing my homework, doing my due diligence, and I don't have all the answers. So if I want to go deeper on a solution or somebody and it's out of my area of expertise, then I call on other people and say, hey, I'm curious about this. And, what's your experience? And that's how it goes. But once it comes up organically in conversations a lot in the course of my work, is that a light will go off and I'll say, hey, I met someone the other day. I just happen to have a demo. Because I do a fair amount of demos on the tech side of things in healthcare, because people will reach out. And again, I don't meet with all of them. I meet with a few of them. Sure. But the few that I do reach out, it's because somebody that I do trust introduced and said, Ann, I saw this tech solution that you might be interested in. And that's all it takes. I have enough respect for that person. And then awesome. I meet with them. And then if it piques my interest, and then other introductions will follow. But so it's kind of interesting. I'm not, the biggest engager, I guess, I don't use any social media other than LinkedIn, but I feel that it's quality over quantity. Mm-hmm. And so I write when I write, and it's authentic, and sometimes it's raw, and not everybody can handle the truth. So some of what I write, people are afraid to touch. Yeah. I've had people say that to me. They said, I love your honesty and your courage, but as some Southern surgeon said, he goes, honey, ain't no CEO going to hire you in a hospital system. And he was teasing me, but it is what it is. Yeah. But I don't hesitate to give credit where credit's due. Yep. And I don't make blanket statements, which is why I use the word often or many, because meaning there are many organizations that are unkind, mm-hmm. and maybe not the best humans of healthcare, mm-hmm. but not all. I mean, many are wonderful. Yeah, totally agree. And the more that you can gatekeep, I think the better. The more that we both can, frankly, the better. We're out here, we're doing it. We might as well tell the stories. And I think letting people choose for themselves is a big deal. As long as as long as we're here and they trust us, then that's a good thing. But, they can make their own decisions based off of the information we're providing. But I would say that we're going to be a way to get the riffraff out, so to speak, and only bring forward the noise. Yeah, the humans of healthcare that are truly by our standards, humans of healthcare, and they're good people, and they've got something that can be valuable, and we know why. We've done our homework as to why. And then if you see them on here, you're at least you can maybe say, oh, I want to pay attention to that, or I want somebody else to pay attention to that, because I think that we need to and we need to share some of this stuff. Frankly, like, it's hard
for healthcare to share their best practices between organizations, as we know. And, that might be cliche to say, but it's like some of the best organizations are doing some really good stuff that some of the worst organizations won't pay attention to because they don't have time. There's like all these real reasons. And I'm empathetic to the real reasons. But man, if we could help break through some of that, and get to use storytelling, entertainment, whatever it may be, these popular things that get through, if we can do that with the best intentions and only the worthwhile opportunities or options for the ones that are struggling, we could really do something. I really feel proud of what we could do by gatekeeping and being good at that. Hey, this is your host, Danny Mobley. Thanks for watching Humans of Healthcare. Please subscribe below for more great interviews.